Thank you for watching the Shakaama Live Show. I want to keep this video brief. The topic is doctors opting out of Obamacare.
And doctors may have to pay fines too if they take Medicare patients and don't have the right electronic medical record system. That system costs thousands of dollars.
So some doctors are opting not to take Medicare patients. And as Christy Myers reports in tonight's Health Check, other Houston doctors are choosing instead to just close their doors.
They're going to opt out in one of two ways. Either they will go to a completely cash system, which before you get your hopes or depression up, people are pessimistic a lot of times when they hear stuff like this. The cash system means that the doctors become more affordable, that procedures cost 1/10 of the price.
What makes this routine surgery so unusual is that the total price, which comes to $2,750, is posted online.
We decided we would have price honesty.
Dr. Keith Smith is the anesthesiologist on duty and the co-founder and managing partner here at the Surgery Center of Oklahoma, which is located in Oklahoma City. 3 years ago, Smith and his partner started listing their prices on the Surgery Center's website, a move that would only be considered radical in the healthcare industry.
The second way to opt out is if they completely, and these are private doctors. I'm talking about private doctors with private practices that you go directly to their office. They will go to hospitals or they will completely shut down, close, and leave the profession.
What is the impact now on doctors?
It means a new horror every month, basically, as we find out more and more things that are required of us.
Requirements like more documentation in order for doctors to get paid, and loopholes that could leave doctors holding the bag. For example, if patients in state health insurance exchanges fail to pay their premiums, the patient gets a 3-month grace period. But insurers are only responsible for paying 1 month's worth of bills.
Those are going to be things that are going to make medicine considerably less desirable. And unless it's addressed, you're going to have a lot of people trying to get out of the profession.
In fact, recent numbers show that more than 9,000 doctors opted out of Medicare participation in 2012. That number tripling since 2009. Many factors contributing to a projected shortage of doctors and the emergence of concierge practices, where doctors take on a smaller number of patients who pay out of pocket thousands of dollars a year.
People that can afford it are going to pay a concierge doctor, and those who can't are going to be left in another system.
Exactly. And the ones who are in the other system, even though they're good doctors, they're so overwhelmed that they're not going to be able to really pay the kind of attention to people, and you're going to have progressively longer waits.
But Dr. Carson sees hope that reform will ultimately fail.
Do you think the Affordable Care Act will collapse?
Oh, absolutely. There's no way it's sustainable.
I'm Jennifer Gilbert, reporting.
A basic tenet of Obamacare is to force doctors to take untenable cuts in pay, all while absorbing overbearing new regulations and mandates with little or no personal recourse. Proponents of the Obamacare law know that they can suffer concessions made in Washington, D.C. as long as the doctors delivering the majority of medical care in towns all across this land are made to heel to the new law's demands. In the end, some on the political left have conjured up schemes to tie physicians' state license to participation in Medicare and Obamacare. Others have taken solace in the notion that the regional ACOs themselves will be able to quash any doctor rebellion by simply using their control of the purse string to withhold or limit how much local money each doctor will be paid for his services.
I'm Ron Tachabana, a family practitioner who has been in practice for 34 years as a small businessman and a physician. I've been fighting Obamacare since the beginning. Being forced to pay for insurance that you may or may not want and you're not getting for what you're paying for, I think that's completely against the Constitution.
Your cholesterol's great.
Most doctors who really care about their patients will quit medicine. Now, at least, if you don't like medicine, you just don't pay for it. But in Obamacare, you have no choices on either end. It's my country, and I'm proud of it, and I don't want it to fail.
Quoting a memorandum by the California Medical Association, Solo Small Group Practice Forum delegation on January 9, 2012, physicians became aware of a bulletin circulated by the American Medical Association, an email authored by an unidentified Center for Medicare and Medicaid, CMS, employee who stated that a non-enrolled physician who treats Medicare beneficiaries must either involuntarily enroll in Medicare or else provide medical care free of charge. Apparently, some embrace conscription of physicians and believe that the federal government can require physicians to work for free.
And I have to tell you, Obamacare is really, I think, the worst thing that has happened in this nation since slavery. And it is, in a way, it is slavery, in a way, because it is making all of us subservient to the government. And it was never about health care, it was about control. And that's why when this administration took office, it didn't matter that the country was going off the cliff economically. All forces were directed toward getting this legislation passed. And why did they want to pass it so badly? Well, as I said the other night on television, Vladimir Lenin, one of the fathers of socialism and communism, said that socialized medicine is the keystone to the establishment of a socialist state. So this is, some people have said, oh, come on, you're being paranoid. How could anybody bring up something like that? I would say, if you know anything about history, how could you not bring it up? And, that's the problem.
The real challenge for physicians today is that they lack true representation by the American Medical Association. Since the AMA's membership represents only about 15% of practicing community doctors in America, and since the AMA lost 12,000 member doctors in 2010 alone, and are expected to have lost at least that amount in the year 2011, the AMA has a real credibility problem with the nation's physicians. Furthermore, since the AMA publicly signed on as a supporter of the Patient Protection and Affordable Care Act, PPACA, with only the implicit blessing of their limited membership, and many local and state AMA-affiliated medical societies remained eerily quiet during and after the contentious healthcare reform debates, the vast majority of doctors feel the organization betrayed them. America's doctors need true representation in the public and to their elected representatives. Without proper representations, doctors are looking for ways to simply opt out of all government health care plans.
And what are the people in the medical community saying about this?
Well, a lot of my colleagues are telling me they sure wish that they could retire like I have, that I got out at the right time. I was planning on getting out even before all of this happened. But, a lot of doctors are going into concierge practices, which allows them to work directly with the patients without a lot of middle management in between. And that means that the numbers that are left to take care of the extra 30 or 40 million people, plus the people who are already there, this is going to be unmanageable. We're going to end up with people waiting for long periods of time, not being able to find physicians, just like they do in other socialist countries. Why would we settle for that? And I think it's a wake-up call for the American people. We need to realize that maybe this battle may be lost, but the war is not lost. Not if people wake up right now, realize that there are opportunities to put people into positions of power.
The worst fears about Obamacare are now being realized in a decision by the Medicare Payment Advisory Commission, the MPAC, established by the law to supervise $500 billion in Medicare cuts. MPAC, whose decisions have the force of law, has voted to impose drastic pay cuts on all doctors under Medicare and, by extension, under Medicaid, which tends to follow suit. The cuts will effectively reduce the real pay for a specialist by 50% over the next 10 years, including a 25% reduction over the next 3 years, and cut general practitioners' pay by 1/3 over 10 years, and that assumes that inflation stays down at 3% a year. MPAC has ruled that specialists must accept a 6% cut in their fees per year for each of the next 3 years, followed by a 7-year freeze in their fees without any adjusted for inflation. If inflation stays very low at 3% per year, this cut amounts to 18% cut in normal and nominal pay and 50% cut in real pay for specialists. General practitioners will face a 10-year freeze on their pay, reducing their real compensation by 1/3, assuming ongoing low inflation. Higher inflation, of course, would make the cuts in real pay even more drastic. Physicians across the country are attending seminars that teach doctors how to start their own direct primary care practices. That means for cash. Direct primary care practices take no health insurance, only cash. In a recent survey conducted by the DPMA Foundation, 2 out of 3 doctors say they are just squeaking by or in the red. And 83% say they are thinking about quitting the business. With the looming threat of Obamacare, many doctors are planning to ditch the traditional business model for a more simple and straightforward one. Doctors are not only opting out because of the cost, but Obamacare is requiring doctors to take in millions of more patients and spend less time with each. It says so right in the bill. An Investor's Business Daily TIPP survey conducted in September of 2009 found that 45% of doctors said they would consider leaving their practice or taking early retirement if the health law stands. More than 800,000 doctors were practicing in 2006, according to the government data. Projecting the poll's findings onto the population means that 360,000 doctors would consider quitting. And even without a mass exodus, the Association of American Medical Colleges envisions a shortage of about 160,000 doctors by the year 2025. It is really a shame that the mainstream media is not reporting on the real impact Obamacare is having. And to put it just in layman's term, and to make this a little bit less boring than what I just did, I'm going to say this. In the Obamacare law, it states that a doctor must have certain medical equipment, certain procedures, certain ways of handling insurance. Obamacare states that a doctor who takes Medicare or Medicaid can only charge so much on his bill. The reality is a doctor in a private practice pays himself, his staff, and his staff includes an entire little department of people who just sit and handle insurance. Medicare then turns around and tells the doctor that they will not cover certain things, that they will not charge certain or pay for certain things. So the doctor, who has to pay for himself, keep the lights on, pay the a lease agreement of where he is and pay his staff, has now taken a pay cut. Under Obamacare, this gets much worse. And as you see, Obamacare originated a group, an agency called Impact. Impact has the force of law. Impact can tell doctors, they have not been elected. There is absolutely no recourse. You can't sue them. You can't fire them. You can't unelect them. You can't recall them. Nothing. None of that can happen. They can simply bring out edicts, and doctors have to adhere to it, which literally means President Obama will have dictatorial power over doctors. This is why doctors are leaving.
Thanks to all of you for being here. Dr. Scherzer, you actually posted a sign outside your office. We've got a shot of it here. And it says this. It was just a reminder to your patients. It says, if you voted for Obamacare, be aware that these doors will close before it goes into effect. That didn't turn out to be an empty promise. You actually said, that's it, I'm done. Why?
It never was an empty promise, and I never expected this picture to come back 2 years later, but here we are. Obamacare is a threat to the practice of medicine. It's a threat to doctors, and these threats have been going on for 20 years. This is what the public doesn't understand. There are swords of Damocles hanging over doctors' heads. In the 90s, early 90s, the coding system for what we have to put into charts changed. And it is so complex, you can't comply with it. For example, if a pulmonary doctor sees a patient and writes a social history down, that was enough. Now he has to put the dates of the social history down. If he doesn't have that information in the chart, he can be fined $11,000 for that claim. And the system lets the government send auditors in who can charge you a percentage of all the charts that they evaluate. And literally, I could be finding myself beholden to the government for over $2 million if they wanted to find things like that to charge me with.
And they were also going to hit you with the cost of installing electronic medical record system?
Computer system would cost anywhere from a minimum of $25,000 for my old office if I just wanted to install new software right now. You never know if that software is going to be viable 2 years from now. If a doctor doesn't have a computer system, you're talking easily $50,000, $70,000. And at a certain point in time, when you have these threats of massive fines hanging over your head, when your kids aren't in college, do you really want to deal with all of this? We're here to practice medicine. Everything that the government's been doing, and especially now, impair our ability to do it. And we went into medicine to do a job that we thought was intrinsically valuable, and it's been turned upside down.
Dr. Hansen, you have decided not to take Medicare, Medicaid patients because they don't even reimburse you for the actual cost that you have in providing the care. Why do people not understand that?
They don't know what we're really being paid. They don't understand the EOBs that come in the mail.
What's an EOB?
An EOB is an explanation of benefits.
Okay.
So you get something from your insurance company or your Medicare statement, and it tells you what the doctor charged, what Medicare or your insurance company paid, what your copay is, and what's left over that everybody writes off. So I can charge $100 for a visit, but if my contracted rate with either Medicare or an insurance company or Medicaid is $25, I write off $75.
75% of what it actually costs you.
Yeah, and some plans you write off, typically our average write-off in our office is 40%. So we get 60% of what we charge, and that's across the board. Some plans pay a little more, some plans pay much less.
So if the government gets more involved in health care and they expand Medicaid, and that's where these 30 million new patients come from, that means those patients walk in and you lose roughly 40 cents on the dollar for what it's actually costing
Medicaid's
you to
even
provide.
worse. I think it's 33 cents on the dollar.
So,
but the problem is there aren't enough Medicaid providers already. I never went on Medicaid. I walked the circle of buildings when I opened my practice 16 years ago, and the pediatricians behind me said, "Are you on Medicaid?" And I said, "No." They go, "Well, don't get on it. It's too much paperwork. You'll never break even." Medicare this past year in November, our practice had to make a decision to stay on Medicare or not. I've been on Medicare my entire life. 15% of my revenue was Medicare. They were threatening 27.4% cuts. My accountant said, "You either need to close, sell out your practice, or stop taking Medicare."
So all this promise that the president's going to take care of more people, he's not if you guys quit. All right, Dr. Pence, you're a cardiologist in Philadelphia. You've been a part of a practice. it's been so tough to make it. I mean, most people think, oh, cardiologists are rolling in dough. You and your partners had to reach into your own pockets just to pay your employees last year. That's a shock, I think, to most Americans, that there's really no money being made in your practice.
Right. Cardiology has been particularly affected by Medicare. Back in 2010, Medicare made devastating cuts to testing that's done in the office. And that's resulted in approximately now about 75% of cardiologists are employed by hospitals. Private practice is quickly dying out. And our reimbursement went down severely. Our expenses continue to go up because of all these complex Medicare regulations for billing. We still have to maintain a fairly large staff, so the expenses keep going up. What you're getting paid is going down. Right now we're not getting paid enough to maintain a viable business. And it finally got to the breaking point recently where 4 physicians have left my practice, one of whom was probably one of the best physicians I've ever worked with. Just was so frustrated, he just quit, and he doesn't even have a job. And whether he returns to practice or not really remains to be seen. And it's quite upsetting to the patients. We have people calling in tears, that their doctor has left, and our staff is having to spend a lot of the time on the phone.
Well, what's so tragic about this? You guys went to college, then you went to 4 years of medical school, did an internship, 3 to 6 years of residency, then establish your practice and actually learn to be really good at what you do. And at the peak of your careers, this policy that's supposed to be so wonderful is causing you to say, I can't do this anymore, and you're making less than members of Congress. I don't think people understand that doctors are not getting rich anymore. Doctors are, on average in this country, they earn less than members of Congress. And with all due respect, what Congress does ain't nearly as important as what these guys do. So when we come back, we're going to do something that President Obama should have done but never got around to, and that's listen to the doctors as to how they would fix health care. That's what we'll discuss when we come back. Stay with us. Let's talk about the reactions you're getting. Dr. Scherzer, what kind of reaction have you gotten from your patients when you said, I'm done?
I had patients very upset, but they understood because I've been vocal about this for years. I was like a racehorse trying to get out of that gate with putting my mind in full gear when I had a patient in front of me until the government came into the fold. And it's gotten worse and worse and worse. And I can't put out of my head the fact that every time I saw a Medicare patient, I was at risk for an $11,000 fine per patient. My patients understood full well. I had cards thanking me, to my surprise, and it's not something I did lightheartedly, but I was fearful of being bankrupted by the system.
Dr. Hansen, if you were talking to a young person today, would you advise them to go into medicine?
No, I've already done that many times.
You've told them not to do it.
I have a nanny, Michigan State grad, math, smart girl. She came down, sat with my kids in the summers, got her a job at NASA for a couple of summers, and she was thinking about doing medical school because of a couple of her friends. And I said, Cheryl, don't do it. Now I regret that, because I want the ethical people to be in medicine. But I told her, I said, you're going to be a government employee. You're going to be under the system. It's 10 years of your life, your 20s, that are taken away from you as far as anything real social. And so she's in biomedical engineering, just graduated from USC in master's. But I felt bad after. In hindsight, I kind of wish, I should have told her to go, because I want good people in medicine, but there was no way I would encourage it.
But you want to be honest with them, and you want to tell them that if you do this...
Yeah, I tell them they have to love medicine. It has to be a calling, just like being a pastor or a teacher. You will never do it for the money. You will never do it for the heartache. You will only do it because you love patients.
Dr. Pence, there's a likelihood that you may have to get out of private practice completely. You would then end up being probably the employee of a hospital.
Right.
What are the disadvantages to the patients if you no longer are in private practice? Because, I don't care what the hospital thinks or even what you think. How do the patients get affected by that?
Well, the patients definitely are affected. It does become an access to care issue. The question is, does the hospital have the resources to accommodate all these patients now who need testing done? And the hospitals may not be geared up to handling that many people. The other issue is if you have the test done as an outpatient in the hospital, your copay is higher as well. And the reimbursements for these same tests that are done in our office that are done in the hospital are much, much higher to the hospital. So Medicare pays a lot more money. So it's actually costing Medicare a lot more money to have to pay for these tests to be done in the hospital.
So both as a taxpayer, we're going to pay more, and as patients, we're going to pay more if this is the shift. Let's talk about your prescription. If you could fix Obamacare and write the prescription, and granted, maybe we could even read it.
Well, we have to do it electronically.
We do it electronically. Dr. Scherzer, what would your prescription for Obamacare be?
I'd make health care expenses tax deductible across the board, get rid of the employer-based health care system, make people responsible for their own payment, have Medicare savings, medical savings accounts, have a high deductible plan in progress for catastrophic care, get the government out of this as much as we can, put the patient in control.
I like
that. Talk to the doctor.
Dr. Hansen, your prescription, if you could write one today.
One thing that I really wish someone would do, and no one really talks about it, is this information. One of my doctors left this month, or in May, and she went to a big system, and some of her patients have not followed her, and I asked why, and they say, well, I don't want my information out in a big system. So she's in University of Texas, I'm a small clinic, it only stays with me. One of the things that frustrates me is there's a lot of duplication in medicine, especially in primary care. They just got out of the hospital. I have no idea what their labs are. Well, yeah, we signed a record release. No one brought them over. I've always wanted the patients, if they could somehow in cyberspace have their own folder that they own with their medical information. We could access it from our computers in the office. They pull up their CAT scan from the hospital. But it's not their hospital system. You understand? It's they get to choose what they want. They get to choose who has access to it. Because we have so much records that sometimes are very inaccurate. And you can check on electronic records now, normal exam. Well, if you put normal male instead of normal female, and you don't catch it, it's in their record. And so there's a lot of duplication of records, there's a lot of misinformation of records, and that's at the core of where I am. I'm exactly like him. Let the patients pay me $50 or $60. They pay that much to get the oil change in their car, but they come in and go, well, it's a $10 copay, I don't think I have it today. They don't really realize that we get paid so little from the insurance companies. Their copay is basically our cash flow for our business. And it's hard.
That is. Dr. Pence, your prescription for Obamacare.
To me, malpractice reform is a huge issue. It's been estimated by some that malpractice adds an extra $50 to $100 billion in healthcare costs. And I think even in Washington, that's a lot of money. And just think of how much healthcare you could provide with that amount of money.
They are not only leaving, they are completely ditching all insurance and going to direct pay. Now, I said don't be afraid. Direct pay isn't the scary thing that you think it is. A lot of people saying, oh, that only rich people will be able to afford it. No, in a lot of direct pay, and I was hoping to get clips, in a lot of direct pay, doctors, some things doctors don't charge at all. Like $1 for syringes and stuff like that, they don't charge for. And they'll charge you $10, $20, $30, $40, $50 for different procedures. And certain procedures, which cost tens of thousands of dollars in a hospital with insurance, will cost a few $100s under direct pay. This means more people will have more access to health care than did before. But the problem here is these doctors then have to take less patients. They can only have 1,500 patients, where under insurance, they had to take like 3,000, 4,000 patients. I like the direct pay model. I pay cash for my health and dentistry. Anything that I do, I pay cash for. Even if I go to a place here that I have to pay cash for, normally they take insurance. They're not set up for people who pay cash. I wish I had, for the few times that I've had a health problem, gone to a place that did direct pay. Direct pay is 1/10 or even 1/10 of what it costs in a hospital or with insurance. All right. I want you to be very afraid of this bill. For those people who want to say that, oh, you don't understand the other side of the story, which is the doctor. I'm telling you the side with the doctor. The doctor, I believe, private practice will disappear in the United States of America, in the traditional insurance practice, completely 100% in a few years. And that's a reality, and you will not have enough doctors in the United States of America due to Obamacare. Thank you for watching the Shakaama Live Show.